I'm Cecilia Liu, ID number U1201758.
And this is Nadia Hatim with ID number U1244951.
Parental diabetes affect offspring. Me and Nadia both searched the terms neonatal diabetes, monogenic and mutation. We both found 479 articles. We both agreed to the article Neonatal Diabetes, an expanding list of genes, allows for improvement, diagnosis and treatment. The reason for choosing neonatal diabetes is to understand neonatal diabetes further and how parental diabetes affects their offspring.
In the first year of life, genetic diabetes is shown during this time. 20 genes have been discovered. The majority of the cases, the most common cause in genetic diabetes is mutation in the genes encoding the two subunits of the ATP-sensitive potassium channel, KATP, KCNJ11 and ABCC8, and the insulin gene INS. Oral sulfonylureas is a treatment for activating mutation. It could be used instead of insulin injections. Neonatal diabetes is predominantly monogenic. This means that mutation is happening in a single gene, which leads to the cause of diabetes. Phenotype encapsulates numerous subtypes, wherein most etiology involves a served disruption in beta cell function. There's two types of neonatal diabetes. The first one is transient, which is a mild condition. It's resolved before 1 year old. It will often reoccur during adolescence. The other one is permanent, chronic condition which requires lifetime treatment. The methodology of neonatal diabetes is polymerase chain reaction. The first stage is denaturation, where DNA is heated at 95 Celsius to separate the DNA strands. Once they become single-stranded DNA, at the second stage, two primers bind to the complementary strand. Temperature may vary due to the size of primer and its homology, usually between 45 Celsius to 60. Final stage is elongation. DNA polymerase extends the primer by its polymerase activity. This is done at 72 Celsius.
Similarities and differences of KCNJ11 gene and ABCC8 gene.
The second most common is heterozygous autosomal dominantly inherited mutation in the insulin gene. B-cell endoplasmic reticulum stress due to the misfolding of the protein encoded by the mutated allele. As a result, there is an increased probability of the potassium channel, which prevents any activation of the voltage-dependent calcium channel and any glucose-induced insulin secretion.
Treatment for neonatal diabetes is sulfonylureas. Sulfonylureas pass by the metabolic steps and binds directly to the K-ATP channel, causing it to close. It triggers depolarization of the beta cell membrane potential, opens the CA2+ and insulin secretes in the patients with gain of functions mutations in K-ATP channel. According to the researchers' data, it shows that 1% to 2% of all case results from monogenic, 60% to 75% with permanent neonatal diabetes is diagnosed under 6 months old. KCNJ11 diabetes usually occur without other complications. Some patients have DD, epilepsy, or DKA. Chances of neonatal diabetes. There is 50% chance of a parent's offspring to have neonatal diabetes.
Currently, there is only 20 known genes. That is the first year of life. Anyone diagnosed under 6 months of age should have guardians on comprehensive genetic testing by clinic computers. We have 1 second.